There are serious concerns tonight over a device meant to protect the most vulnerable among us.
Safe haven baby boxes are supposed to keep newborns who are unwanted safe and alive, but dozens of experts say the feds should step in because no one oversees how they're built, installed, or maintained.
News 5 investigator Sarah Buddison's been looking into this for us, and Sarah's here now to explain.
Robin, Katie, safe haven baby boxes like this are built into the exterior walls of fire stations and medical centers. They are built with alarms, video monitoring, and temperature controls. The company's co-owner and founder says this gives parents a safe place to surrender a newborn. And each new box is unveiled with a special ceremony like the one we're about to show you. But a group of medical and other experts say there is no regulation and no evidence these are safe.
We ask for your blessing on the Safe Haven baby box, as well as the mothers and babies that approach it.
Earlier this month, the Seville Guilford Fire Department in Medina County held a blessing of the box. Their new Safe Haven baby box gives parents a place to anonymously surrender their newborn under Ohio's Safe Haven law.
This is just another way the fire department is responding to the needs of the community.
The box is installed in the exterior wall of the fire station's gym. It automatically locks if a baby is placed inside. Then an alarm alerts staff a child is inside.
We don't want these parents to utilize this box if we can help them beforehand. But if they do need it, it's here now.
Safe Haven Baby Boxes was founded by Indiana resident Monica Kelsey, and she co-owns the company with her husband. For her, they're personal. She was abandoned at an Ohio hospital 2 hours after she was born.
So I stand on the front lines of this movement as one of these kids that wasn't lovingly and safely and legally and anonymously placed in a Safe Haven baby box by a parent that wanted me. But this is my legacy, and I am now their voice.
There are 316 across the U.S. and 13 in Ohio, including Seville. There are also plans for more. Chardon's fire department recently decided to buy one.
I would say that these infant abandonment boxes represent a very laudable goal to help to protect vulnerable babies.
But nearly 100 physicians, child welfare experts, and policymakers, including Yale bioethicist Lori Bruce, are raising concerns about safe haven baby boxes. In this letter to the U.S. Department of Health and Human Services, they ask the agency to take action. They say the boxes pose a wide range of harms and unintended consequences to both babies and their mothers.
They often give birth alone outside of a hospital, and that presents risks to the baby, and that also presents risks to the parent.
So far, 55 babies have been safely surrendered in Safe Haven baby boxes. But the letter notes last year, 2 deaths were associated with the boxes. In October, a dead newborn baby was left in a box in Idaho, the placenta still attached. The 18-year-old mother was charged with a felony. In March, just hours after surrendering her baby, a mother overdosed and died.
These deaths all point to the need for policies that are further upstream, that seek to solve problems even before a box can ever be considered.
The Maryland section of the American College of Obstetricians and Gynecologists recently fought to stop them from coming to their state, arguing there is no research or clinical evidence of their safety or appropriateness. The boxes are not considered a medical device, so no one oversees how they are made, installed, maintained, or marketed.
The way that they're implemented can really fail to meet the needs of the target population.
Among 8 other concerns outlined in the letter asking the feds for help includes how anonymity deprives the baby of both their medical history and a connection to their birth family. We tried to ask Kelsey about experts' concerns about her baby boxes.
I am here to bless a box, and that is what we're doing today. You need to step aside.
But she refused to answer any questions.
I want to make sure I'm giving you an opportunity.
I don't want your opportunity.
To respond.
I don't want your opportunity, okay? So have a good day.
Were you aware of this letter?
I was not. I was not aware of this, so we'll definitely share this.
Seville Guilford Fire Chief Brian Seifert didn't know about the letter or the concerns it raised. He says new mothers and babies should get medical care.
It's the community's job, the hospitals, the physicians. It's their job to educate the mom and get them the resources that they need. This box is just a last resort.
By the way, selling the baby boxes has become big business for Kelsey and her husband, according to a tax document. They made a little more than $2 million in revenue in 2023.
Right, and Sarah, we know Cleveland has decided against installing a baby box.
That's right, Katie. At one point, Cleveland considered putting a baby box at a fire station on the city's east side. But there was concern. The stations are often empty for hours when firefighters are out responding to multiple calls. Katie?
All right, Sarah Buttison, thank you.